talking about something else that I think's been around for a while, but there's been some efforts to bring just culture a little bit more into the forefront. I was going to ask from the audience, who is engaged in or at least know it's happening at your hospital institution where they're kind of putting just culture forward? Is anybody in like a smaller hospital where you're seeing this? Yeah. But I think it is pretty pertinent because it is here, and a lot of medicine is going towards it. So no disclosures. So over the next few minutes, we'll talk about describing this transition from blame to just culture. We'll explain how human behavior and system design affects results. We'll review how to process the harm through just culture. And we'll direct how diverse teams make wise decisions when there's independent input. So healthcare harm challenges, we've talked about this a little bit earlier before. 7% of patients suffer medication error. On average, every patient admitted to an ICU suffers an adverse event. That's a lot. 44 to 99,000 people die in a hospital each year as the result of medical errors. Over 500,000 patients develop CAUTIs, resulting in 13,000 deaths a year. Nearly 100,000 patients die from HAIs, healthcare-associated infections, each year, and the cost of that is estimated up to $33 billion. It's estimated that up to 60 plus thousand deaths from central line bloodstream infections per year. So there are definitely things happening in healthcare where harm is happening to our patients, and we need to address it, of course. And how do these errors happen? People are fallible. Medicine is still treated as an art, not as an exact science, and systems do not always catch mistakes before they reach the patient. Historically, we've had a punitive culture. The institutional model created an aim, shame, blame culture. It hasn't gone away. We've seen this with that nurse who was from Vanderbilt, who had a medication error and is facing criminal charges. So it hasn't gone away. Accountability for error historically lied with the employee. Perfect performance was always expected, and when not achieved, disciplinary action was the way it was handled. And that created a culture where mistakes were hidden. People just wouldn't mention them if they knew they'd be punished. The single greatest impediment to error prevention in the medical industry is that we punish people for making mistakes. And that's by Lucian Leape, who was the gentleman who created the Institute of Medicine's report to Err is Human. So just culture is a person-centered model that offers a very different view. The model was coined by David Marks, who I'll mention quite a bit in this talk. He's an attorney and an engineer. And it recognizes human error, and it helps us distinguish between mistakes and behavior choices. So just culture, as it's defined, as you can see in these four little boxes here, four little triangles, you reconciles no blame and accountability. There's a structured approach to the response. It does not depend on the potential or actual severity of the issue. So really what the end result does not change the management of that event. And it recognizes the responsibility of healthcare providers to follow established safe practices. So again, we can break it now down into really three distinct categories. There's human error, there's at-risk behavior, and then there's reckless behavior. Human error, it's a product of our current system design, such as I forgot to do the 2-hour check. And we manage that through changes in processes, procedures, training, design, environment. For at-risk behavior, it's a choice where the risk was recognized but believed to be either insignificant or justified. I did a one-person transfer with a resident who required a two-person transfer because the resident needed to use the bathroom and everyone else was busy. So we manage that through removing incentives for at-risk behaviors, creating incentives for healthy behaviors, and increasing situational awareness. Then there's reckless behavior. That's a conscious disregard of unjustifiable risk. I knowingly avoided completing a treatment because it was complex and time-consuming. And this is managed very differently, maybe a little more traditionally, we would say, where there's remedial or disciplinary action. So if you want to summarize those in the bottom words, it's human error, generally that's consoled. If it's at-risk behavior, we coach. If it's reckless behavior, that's where punishment comes in. Benefits of just culture is it increases reporting. A lack of reported evidence is not indicative of the state operation. It likewise increases the opportunities, increasing the opportunities is not indicative of a decrease in safety. It also builds trust, that most violations are caused by a desire to please rather than willfulness, and the observation emphasizes the inherent nature of the majority of safety violations. There's more effective safety and operational management. We'll enhance the organization's effectiveness by defining job performance expectations, and it promotes the continuous review of policies and procedures. So a just culture event review process, the error occurs, a reviewing stakeholder committee is created, or perhaps one exists already that handles all these issues. It reviews the timeline, interviews, it gathers, analyzes documents, and then analyzes those interviews and prepares a draft problem statement. Then interventions are described, a timeline is prepared, and then agreements are made with the team to create that problem statement and understand what the desired interventions are. But almost important as everything else on that list is implementing those modifications and monitor their effectiveness. Did we solve the problem? System level factors that can affect safety can be at all levels, all right, from the patient to the task itself, to the provider, to the team, to the environment, to the department, to the hospital, to the institution. And we all could probably think of examples. So I'm gonna do a little exercise, and I wanted to talk about falls, and I asked AI to create a picture of a gentleman falling, and I'm sure everybody in the room can see why that didn't work so well. He's got 3 feet there. So I asked him to put him in scrubs, and it worked better. So think about a recent safety issue that you might have witnessed or occurred, and answer the 4 what are called learning from harm questions. First of all, what happened, right? Gentleman fell. How did it happen? Floor was wet. Housekeeping had usually puts down signs. There weren't enough signs that day, so a sign wasn't there. How will you reduce the risk of occurrence? Well, there's opportunities to educate the housekeeping. There's perhaps you need to buy more signs, so they're available. And then how will you know it worked? Will you monitor for more falls? The science of safety, we talked about that a bit earlier. Every system is perfectly designed to achieve its end results. Safe design principles must be applied to technical work and to teamwork, not just to medication administration or specific issues. And teams make wise decisions when there's diverse and independent input. So it's really important that the team that is brought together both understands and is educated in just culture. Because if they're not developing a plan, creating the team and coming up with strategies can be very challenging. So in that, in the team creation, they'll design 3 principles of safe design where standardize, create independent checks, and learn from any defects that have been created. Now, this slide talks a lot about diversity, which I know is a very sensitive topic currently, but certainly within the medical field and certainly in just culture, you want a team to make wise decisions when there's diverse and independent input. Because principles of safe design apply to technical work and teamwork, and it appreciates the wisdom of crowds, and it can alternate between convergent and divergent thinking, right? So you can emphasize that healthcare is a team effort, the environment where frontline providers can voice concerns and they're acknowledged in those concerns, and then gather as many viewpoints as possible around those concerns. When divergent thinking occurs on rounds, brainstorming sessions, when trying to understand what might be occurring, then you get convergent thinking where you can formulate a treatment plan and focus on the specific tasks. So a lot of value in team. So David Marks created a company called the Just Culture Company. They offer a master's program in Just Culture. They offer support to healthcare systems and hospitals to help institute Just Culture, to educate folks in Just Culture. I went through the training here a couple months ago. And it's very valuable to have folks in various levels of leadership and throughout the system who understand this algorithm he's created. And basically, it's unfortunately it's copyright, so I don't have a really big picture that you can read very well. But basically, it walks you through a challenge that occurs for any situation. Because remember I said the end result doesn't matter. If someone administered the wrong medication but caught themselves right before they injected, so it was a near miss, is treated exactly the same as if they actually had injected somebody and that patient suffered a consequence. So the end result doesn't play into this algorithm anywhere. It's really about those things we talked about, identifying whether it was at-risk behavior, whether it was reckless, or it was just human error. In creating a just culture, you want to hold others accountable and but not consider punishment. Accountability is growth. Growth is caring, caring is influence, and influence is leadership. And you can't be a leader unless you hold yourself and others accountable. So I think it's important to talk about that for 2 seconds. Do I have information before I make a judgment, right? If you're involved, maybe it's in your practice and someone makes an error, before you jump into blame, do you really understand what occurred? Have you clearly communicated expectations? Have you done root cause analysis? Was this human error or personal decision? Have you given the person everything he or she needs to be successful? Right? We had a problem with labeling specimens in our ER, and one of the reasons they were mislabeled is because there was one printer in the whole ER, and it was down at the other end of the hall, and it was very hard to access. So of course that just made it difficult for people to be successful. Have you listened to the employee's reasons for their behavior, and are you certain that this is not where the employee will grow? How can you care for this person and help them grow instead of tearing them down? And what would that look like? It really begins with leadership. It's a behavior, not a position. People in position of formal leadership who do not act as leaders hurt people and their organizations, and we need to discover person-centered leadership behaviors that lead to a just culture. Creating a just culture where you design safe systems, you remove opportunities for error and risk management, you perform root cause analysis when necessary, provide excellent training and retraining in core competencies and systems if necessary, manage system performance through outcome data, and build a supportive structure for where an error occurs. You train staff to respectfully catch each other's mistakes and correct them. And in that supportive structure, you also want to make sure that the person who was involved in this harm is not undergoing issues themselves. So counseling should be available, those kind of things, because the individual who is involved in this can be harmed as well. Employees know that optimal safety is valued. When error occurs, they're seen as learning opportunities. Reporting errors and near misses is encouraged and acknowledged. Employees held accountable for choices, not mistakes. Clear guidance about what unacceptable behavior is and what is acceptable. It's important for more than just reducing errors. Human beings have an innate sense of fairness and justice, and people want to work and are happy in places where they perceive everyone is treated justly. So that's a no blame culture. Do not make the same mistake that many have entered this person-centered journey have made. You must distinguish between a just culture and a blame culture, and no blame culture. A just culture has higher accountability for both the formal leader and the employee, everyone involved. Want to develop standards for conduct, and this doesn't mean policies that exist, but what your expectations are for conduct. Everyone must understand that they've been held accountable for these standards of behavior. They don't have to be long, they don't have to be complicated, but they must exist. They want to create a caring ethos and a sense of security for everyone involved. This is just a quick example of a recent event where we had a couple of Foley catheters placed in the prostate. They were submitted through our processing error service and went through RCAs, and this was the safety alert that then was broadcast on all computers throughout the system subsequently, that talked about how patients were harmed with a Foley catheter, that there's a misconception that when you place a Foley catheter, as soon as placing it too far might cause injury, and that there was definitely improper placement occurring. So the response was to ensure team members are inserting urinary catheters all the way to the bifurcation and noting urine flow, and ensuring there's an auditor. Our system has a 2-person Foley process, and that makes sure that they're aware of the process that exists. Another way is converting M&M, if you have such a process, to QI with just culture, where you view patient care processes and safety concerns, and with just culture is no blame. A number of us with gray hair in the room, I'm sure we all remember M&M, where we presented a case as a resident and everyone tore us up, ripped us to pieces, whether we had anything to do with the case or not, whether we were even in the OR when it happened, but that was what we did, we blamed, right? Just culture doesn't blame. It understands the process, understands what happened, and looks to ways to remedy that. And you can utilize QI methodology to do that. You can readjust the format of the M&M by defining the role, involving the stakeholders, having people from the OR, from the floor come in and discuss, detecting and selecting appropriate cases for presentation, and structuring a goal-directed discussion, and forming recommendations and assigning follow-up. Just a quick plug for Daniel Pink's book, if you're into reading stuff that can be helpful. His book, Drive, really helps understand what motivates people. The course of human freedom has always moved in the direction of more freedom, and there's no reason for that because of our nature to push for it. The secrets are to high performance and satisfaction at work, at school, at home is a deeply human need to direct our own lives. And we are born to be players and not pawns. I just have a couple more slides here. Questions are powerful, empowers others. What do you think what we should do about this? Inspire others. Why are we here? Uncover problems. What is your greatest challenge? Enlighten and call to the right thing. How is it good for the resident for you to do that? Show people you care. Do you have everything you need to be successful today? Lift people up. Do you know how special you are? Educate others. What did you learn from experience? Show what you appreciate and value, and how were you able to accomplish that? So in summary, every system is designed to achieve its anticipated results. The principles of safe design are standardized when you can, create independent checks, and learn from any defects. Principles of safe design apply to technical work and teamwork, and teams make wise decisions when there is diverse input. Thank you.